So thank you for being here for our meditation. I call this somatic meditation because we always do just a little bit of somatic movement before we do the meditation. And the reason being is that somatic movement helps regulate your nervous system. So it's a nice way to begin meditation. Sometimes, depending on the day we've had or what's going on in our life, we could sometimes come with an agitated mind. There might be a little bit of disturbance there. So it's a nice way to bring that calming in. So because this week we're in yoga classes, we're working with healthy spinal movements, and we are doing the spinal flossing in our yoga practices on the floor. So there's an adaptation of what we're doing today in a chair. And the one that we're going to do in the chair today is actually the original one that was designed for your spine. It actually works with the nerves and it can help alleviate back pain. And sometimes this can be discouraging in meditation when we're trying to sit and stay comfortable with our spine upright. We can get back pain. So it can be more easy to do meditation in a chair, but we're going to start with this spinal flossing. So let's just take a couple deep breaths just to ground ourselves. Breathing in, and as you breathe out, just breathe all the way down, grounding. Feel, the sitting parts on the chair, the sitting bones, your legs, and also feel your feet on the ground. You want to possibly be able to, in our spinal flossing movement, be able to maybe take your feet under the chair and then away from the chair and under the chair. Now, I seem to have these bars here which get in the way a little bit, but that's okay. We can work with that. And then sitting upright. And so first, I like to hold the sides of the chair. Like, it depends what chair you have, but you could just have your arms at the side. But if you can grip the actual seat of the chair, feel free to just hold there if that feels comfortable. We're going to lift our chin up. Just kind of stretch the chin. Just be mindful of the back of the neck. Just notice and feel. And then you're going to drop the chin all the way down. And we're just going to do this really slowly. So inhale the chin up. And exhale the chin to chest down. Inhale the chin up. Just feeling. What sensations are you feeling? And exhale all the way down. Okay, good. And one more time. Inhale the chin up. And exhale, just bringing your chin all the way down. And then bring your head back to neutral. Just take a moment to feel. Relax your shoulders. We always want our shoulders relaxed for meditation. Of course, we don't want to feel like we're hunching or carrying the weight of the world. So let them just release down. Okay, and then we're going to bring the legs in and we're going to do one leg at a time. So you just lift one leg. You might feel some sensation. You might feel some tightness in the back of the leg. Just do as little or as much as you like. And then you're going to release and tuck the foot under the chair as much as you can. Actually, if I sit a little forward, there we go. I get a little bit more tuck. So lift, just do the one leg. Again, lifting and lowering. And as you're doing that very slowly, feel in your back and your spine. No, it's possible something might show up, not just in the leg, but maybe a little bit of tightness. And one more time, very slowly. Good, and relax your foot down, rest for a moment. And again, observing. So this is what we do in meditation. Somatic movement is mindful. Yoga is mindful. Mindfulness means we're paying attention on purpose without judging what we're noticing, and we're taking care. Let's try the other leg. Something different might show up. And then tuck the foot under the chair as much as you can go, and lifting up, and move slowly. Good, and a couple more. And lower down. Good. Lift up and lower down. Good. And then pause again. And just notice what you're feeling now. And again, just wherever you're noticing it. Again, it might show up in the back, might show up somewhere else that surprises you. And we're just simply noticing with an affectionate awareness. Okay. Let's bring those two pieces together now. So as you're holding on and as you lift the leg, you're going to also lift the chin. And as you tuck the foot under, you're going to lower the chin. As you lift the leg, lift the chin. As you lower the leg, tuck the chin. And then move with breath. So inhale. And exhale, release. And inhale. And exhale. You find that you have to use a little bit of your core for this. One more time. And exhale. Good. And then just come back to rest again. Take that pause to notice and feel. Okay, let's move to the other side. Okay, so lift the other leg, lift the chin. Exhale, lower and tuck. Inhale, lift. Just let the breath be free. Just let it be what it needs to be. You don't have to go deep, deep, deep breaths, but make sure there's a fullness to it, a freedom to it. Of course, if there's any pain doing this, just do it less. See if you could do even just a little bit of movement. Okay? It's not about forcing. And let's just do one more for this one. This side, and lower down and release. Whew. Take a pause and notice. Take a breath and relax. Where could you relax here just a bit more? Noticing, feeling, breathing. Okay, beautiful. So this is called spinal flossing, and it's kind of a funny word. We floss our teeth, but what does that have to do with our nerves? We can't stretch nerves, but the nerves run along, of course, along our spine. We have a whole entire nervous system, which is a whole bunch of nerves that come out. But we are also working with our fascial system, which nerves kind of run in along them. So when we're pulling, like we're stretching the fascial tissue, it's slippy, slidey. It's like layers of fascia. It's not just a piece of fascia. It's layers and layers and layers and layers. And when we get stuck in the fascia, the nerves can get stuck. This can actually cause pain. So if there's inflammation, of course, it squeezes and it causes pain. So what we're doing is getting that flat fascia to move a little bit more freely. And therefore, the nerves are more free. They can, the fascia slide along the nerves easily. So we're not stretching nerves. It's not about it. This is also known as neuromobilization. Okay. So we're going to try, if you want to, we're going to try all those two pieces together. I find it's helpful to hold the seat of the chair again for this. You need a bit more core here. So if it doesn't work out, just maybe do the head or just do a little bit of a lift with the feet. Don't feel like you have to bring them up. Okay, so as you do lift both feet, if you want to try it, and the head goes up. The chin goes up, I should say. Inhale. Exhale, tuck the chin, tuck the feet both under the chair. And then up, inhale. And tuck, exhale. And up, inhale. Ooh, something doesn't feel quite right for me with this in my back. Okay, I'm going to finish there, but if you feel like doing a couple more, feel free to do that. Breathe. Good. And when you feel complete, just come to that resting place. And we will continue with our mindfulness meditation. So feel like feel like you're in a comfortable seat, a comfortable place. Okay? Sometimes when we're sitting for longer periods over time, we can get uncomfortable, and that's okay. Discomfort might show up. The practice is to try to be with discomfort, not necessarily right away move away from it, but really learn to be with it, maybe discover it, feel it, okay? See what's going on, what's present. And if you are in a chair, feel free to sit right back so that your spine is supported. Don't lean back though, and make sure your spine is still upright, okay? So you can always use a chair as that support system, or if you feel like sitting on the floor, feel free to do that. So your spine, just in a natural way, feel like it's upright. Of course, our spine is never straight because we have natural curves in the spine. And just allowing the breath to be the breath, the breath that breathes, the breath that flows, and the body that breathes. So we're paying attention. If you're comfortable closing your eyes, feel free to do that. Allow your attention to draw inwards. And settling into this moment as it is. And so there is a style of meditation called Vipassana. Vipassana meaning insight meditation. And it's really like bringing your sight inwards, insight. You're watching inside. You're seeing inside. And in the Vipassana, there's a technique called Ānāpānasati. And it's what we always do in yoga, but it's really the mindfulness of breathing. And so just invite you to follow the breath. Like maybe see if you can feel it right at the beginning as it comes in through the nostrils. And then it moves in to the lungs that expand with inhale. You might feel the belly even move and expand a little bit as the diaphragm muscle of breathing moves downwards on an inhale. And that builds a little pressure in the abdomen so the belly pushes out a little bit. And with every exhale, feel the releasing. Feel the diaphragm come back up, pushing the air out of the lungs, out of the nostrils. And so you can pick anywhere to watch the breathing in your body. It might be the belly moving, or the ribs, how they expand and come back. The chest, you might feel a little bit of movement. Maybe you're following the breath in the nasal passages. And the way that I was taught this technique, Ānāpānasati, was to feel the sensations of the breath right at the tips of your nostrils. Just to feel that very subtle sensation there. But you get to pick, see what works for you. You might even watch the whole flowing in and flowing out, like the whole method. You don't have to fine tune to one place, but that's up to you. And this is like, trying things on, see what works for you. If you do prefer your eyes open, try to keep them kind of like droopy, like your eyelids are halfway curtains, halfway closed down, like blinds, and then you're just gazing down. Soft eyes. Okay, so again, it's always yogi's choice. You pick what works right for you. Come back to Ānāpānasati, the mindfulness of the breath. So we don't control the breath here. We're not directing it. We're just really trying to get to know it, just as it is. And as you just let the breath be natural, sometimes little sighs come. Sometimes the breathing pattern changes, maybe as the thoughts come and go, different thoughts can change our breath. Okay, beautiful. And then the next part, the breath's going to always be there. It's going to be there in the background. We're always aware that we're breathing. The next part in Vipassana is body scanning. And we're just scanning through sensations in the body. So I'm going to invite you to begin this at the top of your head. So just bring awareness just right to the top of your head. You might not feel anything there, but just be aware of the top of the head. Any sensations, or maybe it's no sensation. Just observe. Hmm. And then move your awareness down the forehead now. Let's notice any sensations there. To your eyes, the back of your eyes. To your nose. And your cheeks. And again, at the tips of the nostrils, the tip of the nose and the nostrils, just any sensation there of breath. Or if you can feel breath just above your upper lip on the skin there, can you feel the breath there? And aware of the lips and the meeting points of the lips. And you just want the lips softly touching. Maybe the teeth are slightly parted. This might help with unclenching the jaw. And feel the tongue soft inside the mouth. Maybe feel the tongue resting upwards in the roof of the mouth. Hmm. Again, just letting the breath be what the breath needs to be. Good. And then bring awareness to the back of your head and the way that it curves around to the nape of the neck, your cervical spine. It has 7 vertebrae here, and it curves inwards. And just be aware of the neck, the front, the throat, the shoulders. Just feel letting go of any weight of the world. Down the arms. Let your arms be relaxed, hands relaxed. The chest, the belly, just at ease and soft. And then as you come back to the neck, moving into then thoracic spine, there's 12 vertebrae that go down your upper back. Attachment points to your shoulder blades, to your rib cage. Moving down just past the mid back, moving now into the low back, which is another little curve inwards. 5 vertebrae. And then to the sacrum, which is a little bigger, about the size of your palm. I believe it's 5 fused bones. And then at the very bottom is your tailbone. Okay, feeling your hips, your pelvis. Just awareness, noticing any sensations. Let the breath be what it needs to be. Feeling the thighs and your upper legs relaxed. Moving down the lower legs towards the feet, the toes, and feel the soles of your feet connect with the earth. And bring your awareness back up to the spine. And Vipassana, this word that means insight or clear seeing. And the spine that has structure. It has all these vertebrae that stack. And in between each vertebrae is discs that protect the in-between of each vertebrae. And it not only gives you that support and stability, but also gives you flexibility. The way you can move your spine, the way we moved our spine in spinal flossing. And there's another little technique that I did learn and practice through the Vipassana practice. And it's like imagining along the spine is almost like a tube. I mean, it's not literally there, but if we can imagine, the yogis speak of it as a Sushumna, and it's the tube, it's kind of the central axis of where all the chakras reside. But I just want you to imagine this like as a tube. Yes, and there are energy centers there we can't see, but we can possibly subtly pick up on. And as you're breathing, imagine there is this energy flow. And along this Sushumna, there's an energy flow that goes from ground and up. So from your tailbone right up through the back of the skull, top of the head. And then the exhale goes back down out through the tailbone. So imagine this tube. The energy is going up and the energy is going down. And we're going to match this with our breath. So as you inhale, imagine the energy flowing up along the spine. As you exhale, it flows down along the spine. So again, in Vipassana, we're doing that body scanning, sensing sensation. But with this one, you're now bringing the imagination into it. Imagining this tube of energy up and down, moving energy through the body. And see the difference, the quality, the feel, like the inhale. How does it feel different when the energy moves up than when the energy moves down? How does it feel different for you? There's no right, there's no wrong. And just imagine in your back, if you have any kinks or knots or tightness, that this energy is just flowing through and clearing the pathway, opening the pathway so that the nervous system is more free in that sense of 80%, by the way, 80% of your nerves in the body send messages to the brain, and only 20% from the brain to the body. So you're opening up this kind of information highway, how the body and the brain communicate. This is somatic. We're not just beings in our head. We're not just the brain, our thoughts, our logic. We are a whole being. The mind, the body is all one somatically. Okay, my friends. So just bring your attention back here now. Join the hands together in front of you. You can open your eyes, open the three middle fingers. So we actually make a flower with our hands, and it's symbolic of the lotus flower. Padma is lotus, Padma Mudra. So inside the lotus flower, you see the yellow stamen, symbolic of the inner light. And really, this inner clear seeing, utilizing the vehicle of the body, the sensations in the body, the awareness of our breath, it's just helping us to tune into ourselves more and ultimately into our heart space, which is the place of the diamond light. Om Mane Padme Hum. May the jewel within the lotus be realized. You seal your palms together. Bring your thumbs right into your chest. Om Shanti, Shanti, Shanti. Om peace, peace, peace. And so I thank you for meditating with me, honoring the light within you. Namaste.